The new guidelines are important because they give you some alternative to maybe things that you've already tried.
There's very few patients that react negatively to having this brought up, and it doesn't take a lot of time normally to discuss it in a session.
More and more, I think we're going to see that this is going to be one of the measures of our quality that we're going to be evaluated by in practice.
50 million Americans smoke cigarettes. Every year, almost 500,000 of those Americans die from tobacco-related illnesses. The Centers for Disease Control and Prevention reports that each pack of cigarettes sold in the United States results in $7.18 in health care costs and lost productivity. It is critical that health care providers help their patients quit this deadly addiction, and we now have effective tools to help people quit. The Public Health Services Clinical Practice Guideline, Treating Tobacco Use and Dependence, outlines current evidence-based clinical treatments for tobacco cessation. The guideline recommends that every patient who uses tobacco should be provided with at least a brief intervention. A brief intervention, lasting 3 minutes or less, consists of 5 components called the 5 A's. Ask every patient at every visit if they use tobacco. Advise every tobacco user to quit in a strong, clear, and personalized manner. Assess each patient's willingness to make a quit attempt. For the patient willing to make a quit attempt, assist patients with counseling and pharmacotherapy. Arrange follow-up contact. Filling out a personalized quit plan sheet during interventions can also be useful. It helps patients identify barriers to quitting and provides them with strategies to help overcome those barriers. And the uses of pharmacotherapy and tobacco dependence counseling have been shown to double and even triple quit rates. Clinicians have a unique opportunity to intervene with their patients who use tobacco. 70% of tobacco users visit a healthcare provider every year, and the majority of tobacco users want to quit.
I've had patients come in years later and say, "Doc, I listened to your advice and I stopped smoking." And that caught me totally by surprise because I had, at the time, interpreted the patient as being resistant to what I was doing.
If you're non-judgmental in your approach, they usually will be pretty frank about what's actually going on.
We have to take more of a approach that we have more to say and not just let them shut us down when we really should be able to help them more.
In the next few minutes, we will show you vignettes that demonstrate different patient and clinician interactions. In this first session, watch carefully for examples of ineffective or effective problem solving.
Morning, Miss Drake. I see from your chart that you smoke, is that correct?
Yes, I do smoke.
What do you think about quitting?
I've thought about quitting. I'm actually going to be starting this new job, and it's going to be in a smoke-free office, so I've thought about it.
Well, those are some great reasons to quit. New environment, smoke-free area. It'll probably work for you.
Yeah, I think so. I mean, I'm really worried about gaining weight. You know, I've tried to quit before, and I gained some weight, and I didn't really like that.
How much weight did you gain when you tried before?
Like 5 or 10 pounds, I think, but that's just too much weight to gain for me.
Well, let me be honest with you. That's pretty typical. Most people that quit gain weight, and they gain about that much. But you got to be realistic about this. Put it into context. You smoke, what, a pack a day?
Yeah, about a pack a day.
So, to put the same strain on your heart as a pack of cigarettes would be you'd have to gain, what, 80 or 90 pounds? I mean, it's in the same league. And you just can't kid yourself that gaining a little bit of weight is bad for you if you continue to smoke.
Well,
So, are you ready to set a quit date?
Well, I don't know. I mean, is there any way to do it without gaining so much weight? I mean, you said that most people do gain weight. And as I said before, that's concerning to me.
Well, about 3/4 of the people do in the short term, but, well, you know, there's no magic wand that I can wave over you to keep you from gaining weight. Well, you've just got to accept that that's something that goes along with the long-term health gains of quitting smoking. You kind of got to keep your eye on the big picture.
So I can't take any medicine that will help me not to gain the weight?
Well, we have some things that will help you stop smoking, but no, it's not going to help you stop gaining weight. I mean, if that's your goal out of this, to quit smoking and not gain any weight, then you're simply going to fail. And you shouldn't even bother if you're not willing to accept that.
I don't know. Maybe I'm not ready to quit then. I just don't think that...
Yes, well, I see you're a little reluctant about this, so perhaps this isn't the best time for you. Have a nice day.
The clinician could have improved the brief tobacco cessation intervention you just saw by employing these strategies. Directly advising the patient to quit tobacco use. Congratulating the patient on past quit attempts and interest in quitting now. Listening to the patient's concerns or perceived barriers to quitting. Helping the patient develop solutions to overcome perceived barriers. And explaining that clinicians and staff can provide support in the quitting process. Let's watch this session again with these strategies in mind. Notice that conversations that help people quit can be surprisingly brief.
Good morning, Miss Dredd. How are you?
Fine, thanks.
What can I do for you today?
Well, I got a new job and they require a physical before I start working.
Great, great. Congratulations.
Thank you.
I'd like to start by getting your health history. I see here that you smoke, is that right?
Yes.
How many cigarettes do you smoke each day?
About a pack.
Quitting smoking is the single most important thing you can do for your health now and in the future. So, what are your thoughts about quitting?
I've thought about quitting, I guess. I can't smoke at my new job, so I've thought a little bit about it.
Many people find that they change their behavior when they go into a new environment where they don't have all those associations.
Oh, really?
Yes. And the fact that your new job is smoke-free means that it would be working in your favor rather than against you. So when do you start your new job?
Oh, in about 2 weeks.
Okay. That would give us time to get things in place so that you could start your first day on the new job smoke-free.
How would that work?
There are a couple different things we could do, given the amount that you smoke. I think that it might be helpful for you to try some medicine to help you with quitting. I'd like to know if you've tried to quit before and how it went with you.
I've tried once before.
How long ago was that?
Oh, about a year ago.
And how long were you able to quit smoking?
I would guess maybe a month or so.
Well, congratulations. You've had a lot of practice at quitting. Did you have any medicine to help you quit?
No, I didn't use anything, and I gained some weight, which was kind of concerning to me.
How much do you remember gaining last year?
About 10 pounds, but I know it's not good to gain weight.
Well, certainly there aren't many people that are pleased with gaining weight, although it's pretty common. About 3/4 of the people experience some weight gain after quitting. But the longer they stay quit, the more they can begin to address the problems for their weight gain. Some of the medicines seem to delay the weight gain in the people who try them.
Really?
Sure. Plus, people who stop smoking are more likely to be more active the longer they stay smoke-free.
I do like to exercise a lot.
Well, I don't know if you noticed this when you quit before, but people who are active are liable to notice the benefits of quitting smoking more quickly.
Now that you mention it, it was easier to breathe during my aerobics class.
It's great that you have an exercise pattern established.
Mm-hmm.
That would be another advantage for you in terms of managing your weight in the long term.
So, do you think if I gained a little bit of weight, I could lose it again?
I think it would be a short-term thing, especially considering you like to work out. I mentioned medication. I think it would be a benefit to you, especially with withdrawal symptoms and your weight gain.
Well, that'd be good. I'd like that.
I'm writing you a prescription for bupropion. You can get started on that right away. Let's set a quit date sometime before you start your job. That means you agree not to have a single puff after your quit date. When would you like your quit date to be?
A week from today would be good.
Great. You'll have the next week to plan your quit date. Now tell me, what do you think the biggest problem will be after you quit?
I always reach for my cigarettes in the morning right after breakfast. That'll be hard.
What do you think would help you with that?
Well, I guess I could make sure I don't have any extra cigarettes lying around in the morning to tempt me.
That sounds like a good idea. And you might consider eating in a different room to break that association between breakfast and cigarettes. Here's the number for the tobacco quit line. I strongly recommend that you call them. They'll help you with ways to anticipate and plan for situations where you're likely to smoke. Have you got any questions?
I don't think so. I'll call the quit line this weekend.
I think you're making a great choice for your health by quitting smoking, and we'll be there to help you. We'll call you in a week or so to see how it's going.
In the brief intervention you just saw, the clinician effectively used the strategies discussed earlier to help in the quit attempt. He urged the patient to quit tobacco use in a strong, clear, and personalized manner. He congratulated the patient on past quit attempts and interest in quitting now. He helped the patient identify benefits of quitting. He counseled the patient about appropriate pharmacotherapy and arranged follow-up contact with the patient either in person or via telephone, ideally within a week of the quit date. Sometimes patients are not yet ready to quit tobacco use. By delivering brief motivational interventions to these patients, clinicians can encourage them to quit at a later date. Motivational interventions are most likely to be successful when the intervention is built around the 5 R's. Work with the patient to examine the relevance of quitting for him or her. Highlight the potential risks of continued tobacco use. Identify the potential rewards of stopping tobacco use. Identify the roadblocks to quitting and how they might be overcome. And repeat the motivational intervention at every visit. Let's take a look at the next session with these in mind.
Good morning, Mr. Powell. I hope I didn't keep you waiting. What brings you in today?
For the past several days, I've had a severe cough. It's probably just a cold or a sore throat.
Well, I see here that you smoke. Is that correct?
Mm-hmm.
About how much do you smoke a day?
Oh, 2 packs.
Well, given that you're here and looks like you've had a cough that's been productive for a couple days, it's an indication that you could have a lung or respiratory tract infection.
I don't think it has anything to do with my smoking, though. It's probably just a sore throat or a cold.
About how many times a year would you say you get a cough or sore throat?
Probably 5 times.
Okay. Well, did you know that people who don't smoke actually get a lot fewer colds and strep and the other things you were talking about? If you were to quit smoking, you'd see improvement to your health pretty quickly after you quit. Quitting smoking is the best thing you can do to improve and protect your health. I'm interested to hear your thoughts about quitting.
I tried to quit about a year ago.
Well, how'd that go for you?
It only lasted about 2 days.
Well, congratulations on your quit attempt. You made it through the first couple days, and that's often the hardest part. What do you think made you start smoking again?
I have a lot of stress in my life. My job, my wife. I have 2 kids, a 3-year-old and a 5-year-old.
Oh, that does sound pretty stressful. Tell me, have your kids been troubled by asthma or chronic ear infections or colds?
Well, the usual, but I thought all kids get ear infections or colds.
Well, you're right about that. Lots of kids do get ear infections and colds. But kids who are exposed to smoke in the home are much more likely to get them.
Yeah, I heard a little bit about that. I don't want to hurt my kids or anything. I remember trying to quit about 5 years ago when my first daughter was born, and then again last year, but it just didn't seem to work.
Well, it's great that you tried to quit. You know, that's an important step. You know, many people attempt to quit 5 or more times before they quit successfully. Each time you try to quit, you learn more about what works and doesn't work for you. Now, I'm wondering, when you quit for those 2 days, did you use anything to help you?
No, I tried to quit on my own. My wife smokes, too.
Okay, so there's another smoker in the home. Would you consider another quit attempt if we could put some medicine called nicotine replacement therapy in place to help you with withdrawal symptoms you had last time? It's available as a gum, lozenge, patch, nasal spray, or inhaler, and it helps to lessen the withdrawal symptoms like irritability and anxiety.
Well, with all the cigarettes in the house, I don't think I could do it.
Well, I'll be honest with you. It's not easy to quit with another smoker in the house. On the other hand, I've worked with lots of people who've had multiple smokers in the house, and with a little planning ahead of time, they've been able to quit successfully. Medicines like nicotine replacement therapy make it easier to quit than quitting smoking cold turkey. Quitting cold turkey is really a lot more unpleasant than it needs to be. Nicotine replacement therapy will make it, not easy to do, but it makes it easier by reducing unpleasant feelings and cravings.
If I could just talk my wife into quitting or smoking outside, I might try again. I won't smoke in the house, but I don't think I could totally give up smoking right now.
Well, I think you've made a great decision for your kids' health by not smoking in the house and asking your wife to do the same. Should we plan on revisiting your thoughts on smoking at your next visit in a couple of months?
Okay.
Great. In the meantime, you might think about things that are going to get easier and better in your life if you quit smoking. You might ask your wife to try to quit with you. Now, also today, we want to address your concerns about your lungs and your breathing. That's definitely something that's going to get better if you quit smoking.
All right.
Great. Let's put that on the agenda for our next visit.
Okay.
In the brief intervention you just saw, the clinician used strategies to help increase motivation for a future quit attempt. She identified why quitting is personally relevant for the patient. She helped the patient identify negative consequences of continued tobacco use. She encouraged the patient to identify benefits of and barriers to quitting. And she planned on repeating the motivational intervention at the patient's next visit.
As a clinician, there is nothing we can do that will help our patients more than to assist them in successfully quitting. Even interventions as brief as 2 or 3 minutes have been shown to about triple the rate that smokers will quit. We now have a series of counseling and medicines, all evidence-based, that will help them to quit successfully. And we know that our patients report that they got better care from us if we raise their tobacco use with them. Nothing puts our patients at greater risk, and now we have the tools to help them to quit.